I sincerely apologize for that break in transmission. We have a little bit of technical issues which we're trying to rectify, okay? In a little bit, we'll be talking with Dr. Nancy Cherovsky. For those of you who are just joining us, Dr. Nancy Cherovsky will be talking to us about beauty enhancements, the dangers to watch out for in beauty enhancements. How much can you do? What are the signs and symptoms that should be a red flag to you, and what to do when you experience those symptoms. We're going to try and reach out to her again, and hopefully we'll be able to add her on, failing which we will do a telephone interview. But this conversation is very important at this point because in the African community we are recording, or we're seeing a lot of deaths among women who have chosen to do who have elected to do body enhancement surgeries. Okay, so for those of you who are joining, welcome to your Saturday online program. This program is sponsored by African Views, and it is supported by Regina Williams Foundation and Campaign for Nurse Excellence in Nigeria. Okay, this program targets the African diaspora communities and highlights the health problems in those communities, and then talks about ways or how to handle those health programs. All right, we have Dr. Cherovsky on the phone.
Yes, I'm on the phone.
Welcome, Dr. Cherovsky. It's very nice to have you with us, and we are grateful that you were able to accommodate us in your agenda, because we know you have been a little unwell. How are you feeling?
Better, Regina. Thank you very much, and it's my pleasure to answer any questions that you have.
Thank you for joining us. All right, so today we're all about beauty enhancements. Before we jump into the questions, can we talk a little bit about what you do, your profession right now, and your specialty? How come you are into the beauty enhancement industry, and what exactly do you offer?
Okay, well, I've been in the field of plastic surgery and dermatology for 30 years. My husband is a plastic surgeon, so I have always assisted him as his nurse in the past 30 years. Since becoming a nurse practitioner and receiving my doctorate degree, I've been more focused on areas of surgery that are safe for patients, because that's an area where a lot of people think procedures and surgeries and even some cosmetics we use are safe, when in reality then not all of them are safe, and we need to be very aware of the outcomes that they may give some individuals. So that's my focus right now, to keep everything safe and to provide evidence-based practice for education for women and men too, seeking these procedures.
Thank you very much, Dr. Cherovsky. All right, so let's just jump into it. Now, there seems to be a rave in beauty enhancement surgeries. We see women like going for the bigger the better. A lot of breast enhancements and butt enhancements and what have you. What is responsible, what in your view could be responsible for this drive to expand the body parts, if so to speak? What could be pushing this?
I think, Regina, honestly, what's pushing it the most is the social media and the social media movie stars, like the Kardashians, and I'm not just focusing on them, I'm just on different individuals that have a lot of social media exposure.
Yes.
They make it seem like these procedures are like changing your hair color, and they're not. These procedures have risk and benefits. And it's not as easy as it seems. But unfortunately, on TV, on Netflix, on Amazon, everything seems a lot easier than what it really is when it comes down to it. And that's what scares me. And that should honestly scare other people looking into these procedures, so that they're aware of what's safe and what may not be safe.
Exactly. So let's talk about what is safe and what is not safe. Because, I mean, it's not wrong to want to, you know, look better, look nicer, and hang up everything that is pointing south, but you shouldn't have to die because of that. So what procedures can we do that you would consider safe and those that you would consider unsafe?
Okay, the procedures that have the highest risk associated with them are usually the plastic surgery or procedures that are longer than 45 minutes to an hour. That's where the risk sometimes then starts to outweigh the benefits. And I'm talking about large volume liposuctions, fat transfers, implants put in, whether it be in the breast or the buttock, that are either too large or put in by providers that don't have the knowledge or certifications to put in these implants. These procedures over an hour can come with risks such as forming clots in the leg, and that's where a tight protocol needs to be followed so that the patient is not put at risk. There are procedures like breast reduction, which definitely many times the risks are there, but if appropriate actions are taken, then the benefits outweigh the risk, and the woman has a better quality of life because she does not have the large breasts on her body anymore that interfere with her daily living. So it depends on the procedure the patient is seeking, and then you have to sit down with the patient and say, what are the risks? What are your benefits? And then the patient should decide for themselves what's best for them.
Okay, so let's start with the minimal to the invasive. First of all, like a woman like me, I'm 50 years old, and I like to, you know, take care of the sight lines and the smile lines and anything that seems to be shrinking, like on my face. What do you suggest as the safe procedures I could do to, you know, enhance my face and not die for it?
Well, first of all, you look beautiful. I would not ever think you were 50, so whatever you're doing is perfect.
Thank you.
As far as I'm concerned, we have a little probably different view than most plastic surgery procedures. We think less is more. And I personally, as a woman, I'm 60. I personally, as a woman, feel that it's more natural for the face to age. Yeah. Not to say that Botox is not something a woman should, or a man should want to receive if that's bothering them, some lines on their face. And Botox is very temporary. So after 3 to 4 months, if the patient didn't like the Botox, then they wouldn't have to receive it again. The Botox botulism effects will fade, and therefore the patient will have the same wrinkles, or at least a little bit less than what they started with. We have more risks, we feel, that are associated with fillers. Matter of fact, there seems to be a trend now, especially in Hollywood. So many women have put fillers into their face that they're now using reversal agents to take the fillers out of the face so that they don't look so puffy. So I think my advice would be, it's not that I would talk someone out of it if they absolutely wanted to use fillers. The thing is, go slow, and less is more. And it's okay to have your face age naturally. I think we're getting away with the fact it's nice for a woman to have a little hollowness in the face. You know, we earn that as we age.
Okay. Thank you so much. So fillers are not very advisable, but if you have to do it, you go slow with it. When you say go slow, like you mean a little volume, or what do you mean by go slow with it?
So when I mean go slow, there are different types of fillers on the market. Mm-hmm. There are some fillers that last maybe under a year, or even maybe like 6 to 9 months. Mm-hmm. And now we have fillers that can last longer than 2 years. If someone was going to try a filler on their face, say their nasal labial folds, like above their mouth, below their nose, where we tend to get a little crevice deepness above our smile line, then I would tell them to use the short-term fillers first, see how they like it, see how they do with it, because technique is important. It depends upon the provider who's administering the filler, the best result that patient will get. So my advice to a woman or a man would be to ask a friend that they know how to filler. Yes. If they like the result, then they should use the provider that person went to.
Okay, so still talking about fillers, right? How does it affect the body? How does the body absorb the fillers or reacts to it? Because there was a woman who had fillers, and then she had like keloid tissue on the lines where she had the fillers, and then she had blistering of the lips where she had fillers. So does your body like mount a rejection thing against the filler?
Okay, I actually saw on your website that you posted some pictures of someone that had very poor results. We actually have had some patients come to us in my husband's practice with defects to their face after they had fillers. We do not administer fillers. We only do Botox in our practice. Many times that occurs because the filler was not injected deep enough into the tissue, and therefore it was very superficial, and that's why these patients received the poor outcomes that they did. You also have to be very careful around the mouth, administering these type of products around the mouth, because especially some patients that have history of a herpes outbreak, cold sores, they're more at risk to have blistering or can have blistering around the areas that were injected. So the thing is to talk to the provider, and again, go for a referral to someone that you may know has had it done already and had a good outcome. Then you know that provider probably is administering the filler or the Botox properly. That's really important. You can't just go to anyone without knowing their background or their experience or without their credentials. It's like buyer beware. You have to be careful.
Okay, thank you so much. Now let's talk about fat transfer. People have transferred fat from different parts of the body, maybe from the buttocks to the breast and what have you. And is that advisable? Because first of all, it's from the same body, so there is no concern for rejection. Secondly, how does the fat stay alive? If you take it from the butt to the breast, what keeps it alive? The blood vessels supplying the fat tissue will be disrupted. So how does the fat stay alive? And also, when you do fat transfers, let's also talk about how much fat you can take out of the body at one time in terms of when you consider liposuction. Dr. Cherovsky.
Okay, so you have a few very good questions. The first one, let me try to answer as best as possible. Fat transfers, especially are worrisome when we take fat from one area to the body and try to put it into the breast. Fat doesn't necessarily have a good blood supply, so I think you asked a lot of questions. What would keep the fat alive? The patient usually does better if they're young, healthy, don't smoke, therefore their vessels are not compromised in any way. But even taking fat from a healthy person and transferring it to another area of their body, especially say the breast, that fat can necrose, meaning it can die over time. And when it dies, it tends to form like a lump or a hardness. So now if you transfer fat from the buttock or the thighs to the breast, now the woman may think down the line that she has a breast mass, and that becomes a worry situation for her or him, because they now worried, well, could I have a lump? Could I have a mass? And many times it's due to the fat transfer. So you have to be very careful when you do fat transfers. Even if you're, like you said, if you're young, you're healthy, the larger volume of any transfer that you do, so to increase the risk of having a patient having potentially a poor outcome. So you must be very careful. And it has to be done sterilely. So this is the type of procedures that should be done in hospital or in a provider's office that has the certification to provide operations of this type of risk in their facility. So that's really important.
Okay, thank you. Now we wanted to talk about how much fat you can take out of the body and without endangering the patient. For example, we know that truncal obesity is a major cause, or could lead to hypertension in some people. So if you want to take out liposuction from the if you want to take out fat through liposuction from the midsection, how much fat could you take out at one point?
You know, that's a good question. I can't answer that honestly because it depends on the size of the person.
Mm-hmm.
So I don't want to just give a general a figure and mislead anyone, but there is a limit to any amount of fat that can be transferred, but it would depend on the patient's body, like what their body looks like and their height and weight. You know, as far as that's all taken into consideration. It's called body surface index,
yes.
And we use that to put a patient to see what their risk is for any surgery.
Mm-hmm.
So their body surface index is what's important. So it's not like a one size fits all.
Yes.
So I don't want to give an exact number. That would be something the woman or the man should talk to with their provider based on their body frame and their height and weight.
All right, thank you. Now let's talk about breast enlargement. There are different things that get put into the breast to, make them bigger. Sometimes we have saline bags, sometimes we have silicone, sometimes we have fat. You have explained the dangers of putting fat transfers to the breast. Could you talk a little bit about using silicone or saline bags in the breast? What are the long-term effects that we should be careful of?
Okay, this is a really good question again, and one that's come up quite recently in the media. I'll just give you a little history. Back when my husband started practice, which is about 31 years ago, there was a lot in the media back then. We didn't have the media like we do now, but back then about the dangers of silicone implants.
Yeah.
And a lot of women claimed, and who we examined ourselves, that they had autoimmune diseases, and because the silicone implant had ruptured and they developed silicone granulomas, which are migrating silicone masses that form in the neck or the chest or the breast or anywhere else. So what the government did, the FDA stepped in, and we have the FDA here in the United States. They stepped in and they looked at everything and they put a moratorium, which meant that you could no longer use silicone implants on patients unless they had a previous silicone implant for breast reconstruction. So for 14 years, these silicone implants were actually off market, and a woman could not receive them unless she was part of that moratorium. Back in 2006, the FDA stated that the implants, silicone implants, were now safe to come back to market as long as they were studied long term. They are now back to market, but just recently, the company called Allergen, they're also called McGann. They have two names. They actually make a silicone implant called BioCell, textured silicone implant. That implant has been recalled because there seems to be some association. I'm not sure if they know exact, but some association for an increase in a very rare cancer. It's called large cell lymphoma, anaplastic lymphoma.
Oh,
so we're waiting to see. So if someone does have a textured silicone implant in their body that's listening to the show, they should actually seek advice from their provider to get information on what they should do next to have this implant removed.
Yes.
So far, smooth. When I speak of smooth, I mean it's the type of material that the implant feels like. So textured feels rough. Smooth feels smooth.
Yeah.
So smooth, textured, saline, and silicone implants are not part of this recall. Not.
Okay.
So both give a very natural effect. I'll be honest with you, I'm just myself more partial to saline because of the history of silicone and what we saw. Saline to us seems to be a safer option, though other people would differ. But that's just our personal professional opinion.
Doesn't the saline get absorbed by the body or leak or something?
If the saline the implants are not guaranteed for life. So, and they, after 10 years, their life expectancy starts to increase for for the incidence of rupture to occur. Not that it will occur, but as they get older, so does the incidence that the implant could rupture. If it's a saline, smooth implant, if it ruptures, then the body will absorb the saline, or the patient will urinate it out. If the silicone implant is ruptured, this is where the problem is. It's called a silent rupture. If a saline implant ruptures, the woman will know that it's ruptured within usually 24 hours. Mm-hmm. If a silicone implant ruptures, the woman or the man would not know that it's ruptured. They actually may not know for months or a year or beyond that, because it's considered a silent rupture. Mm-hmm. So silicone implants, if a person, if they agree to get them, they must have an MRI 3 years after the initial implantation of the saline implant, of the silicone implant, mm-hmm. and every 2 years after the initial MRI. Mm-hmm. And what we're looking for is that silent rupture.
Yes.
You don't need MRI screening with the saline implants, only with the silicone implants.
Yes. Oh my goodness, this is so good to know. All right, let's talk about butt implants now. There is cupping. Sometimes they cup the breast, and sometimes they cup the butt. They apply pressure that would do something to the butt tissue or to the breast tissue to make it expand or enlarge. What do you say to that procedure? After that, we'll talk about real implants that, get malpositioned in the buttocks and what the woman could do about that. Let's talk about the cupping of the tissue.
Okay, we do not choose to do butt implants in our office setting, but I will tell you that we have seen patients that have had problems with them, and I think it's from what you're just asking me, the cupping. Mm-hmm. They tend to give the butt a misshape, or the patient has trouble sitting or laying down on them. I can only speak that I've seen it, but I can't speak of, we then send patients to what we consider to be a surgeon that has a lot of experience mm-hmm. in buttock implants. Mm-hmm. We send that patient to that facility to get a better opinion on what to do. Oh, most likely, they're going to have to be removed. That's because they're causing the patient pain. They're causing the patient to have misshape to their buttock, and that's where we advise them to seek better experience and to maybe think about getting them removed.
All right. So now let's talk about deaths from elective body enhancement surgeries. How many surgeries can you do at one time? Most of the deaths result from some kind of embolism, which we'll talk about in a little bit. But let's talk about how many surgeries that a woman can get done at one time, a woman or a man can do at one time. Can you say this is not invasive and this is invasive, so I can combine the invasive and the minimal together, and I'll be fine? What dangers should you look out for?
Okay, so the dangers always go back to first the patient themselves. What's the patient's medical history, mm-hmm. surgical history? The patient is, the person ages, so does the risk associated with any procedure. Mm-hmm. The timing of the procedure. So if what you just said, if someone's having a 1 hour, say, breast augmentation procedure mm-hmm. with implants, yes. and then they decide to have a non-surgical procedure, and at that point that patient can be awake for the non-surgical procedure, then that would be okay to combine two procedures, non-surgical and surgical. It's when a patient's having a surgical procedure that you have to look at not only their medical, their surgical history, their age, but also the length of that procedure. So let me take, for instance, breast reduction. Mm-hmm. Breast reduction is usually a 3 to 5 hour procedure. If you combine that breast reduction now with liposuction of the hips or abdominoplasty, you're now increasing that procedure to 6, 7, or 8 hours. Right there, that puts the patient it can put them at grave risk for increased complications, especially pulmonary embolism. We don't really understand physiologically why pulmonary embolism occurs, but we know that there are certain patients definitely more at risk for it, and putting them at risk will be when they put themselves at risk having too much surgery, or a provider puts the patient at risk because the patient doesn't understand that it's risky after a certain amount of hours to be on that operating room table, but the provider should. So the provider should actually these procedures, like I said, are not changing hair color. We need as providers to be safe and to make sure our patients are safe. That's our number one priority. But patients don't realize that they are procedures, many of them, that can be risky. So the less is more. So if you're having one big procedure, 4-hour procedure, that's where the limit should stop. And
Okay.
then the patient can go back at another time and have another procedure.
Okay.
But okay, I'm sorry.
Go ahead, please. I'm sorry.
I just many times patients don't want to go back. It could be money wise. It could be they don't want to have anesthesia again, and all of those are legitimate reasons. But you have to look at the risk and the benefits. If the risks are high, unfortunately, I don't know if many people know of Kanye West.
Yes.
He lost his mom under a plastic surgery procedure, and many people feel it's because of the amount of procedures she was having on the table, and that's the type of what we want to avoid going forward with any patient.
Okay, thank you so much, doctor. Now, a patient could have procedures done, and they're okay for the first 2-3 days, and suddenly they develop symptoms, rash on the skin, inability to breathe, confusion, and then suddenly they are dead. We know that some of these signs and symptoms are, symptoms of some level of embolism. Can you talk about symptoms that patients need to report immediately to their provider if they start noticing them after the surgery?
Well, the first thing I want to say is the provider should actually teach the patient of these symptoms before any procedure is done, so that the patient's aware that if they have any swelling in their leg, if they have any pain in their leg, it's usually is unilateral, one leg, not both legs. If they have any trouble at all with any shortness of breath, they're immediately to report to the emergency room and call the provider immediately. So that conversation should take place not after surgery, should take place before surgery.
Yes.
And the provider should use a scale. We use a scale called a Cabrini scale in our office. It puts the patient, we give them a point system, and we add up the points. If their point system is higher than what it should be, then we won't do the surgery. So that Cabrini system helps us guide with the patient. I use it right in front of the patient. I add up their scores. Are they on birth control? Are they on hormone medication? Have they ever had varicose veins? Have they ever had a miscarriage? Do they have any clotting disorders in their family? Is the procedure over 45 minutes? All those questions, and I could give you a copy of that if you'd like for your audience. I'd be happy to send it to you.
Thank you.
All those questions should be asked prior to surgery, and if the points are higher than 4 to 5, then that surgery should not be done.
Whoa, okay. Now, even when the patient goes to the ER, I know that if it's a blood clot, like a thrombus, we have a protocol to handle, a thrombus. We use blood thinners and manage the situation if we get to it on time. But what about if it's a fat embolus? How do you handle a fat embolus?
Okay, so a fat embolus is handled, and that's occurred, unfortunately, not in our practice, but I've been a nurse taking care of patients in the intensive care. That's treated with an alcohol drip. The fat embolus usually occurs after liposuction. That's when you'll see that. A patient would then, of course, be hospitalized, but they'll put on an alcohol drip to dissolve the fat emboli. The patient with the pulmonary embolus, see the problem with that, yes, we can give heparin, we can give other drugs that dissolve the clot, but then the patient's at risk for bleeding if they just had a surgical procedure. So it's really, really a very difficult situation and can be very risky. So that's why these conversations need to occur with the patient before any surgery is done, for the patient's safety.
All right.
It's important.
Okay. All right, can we talk about, you did talk about some of the symptoms to report. If somebody has just had a surgery, are there any medications the person should be on, and for how long should the person be taking these medications after the surgery? in most cases, in places like Africa, people are not very well informed, or a protocol was not established for the patient to be educated before they went into this surgery. But if we educate them on questions to ask the provider, it will go a long way to save us from some of these deaths we are recording right now. So after surgery, what are the medications, or what type of things should a patient be considering? Foods to eat, meds to take to keep your body recovering nicely.
Okay, so a patient should not take any aspirin, Advil, Motrin, or any type of medication that can increase their bleeding time, that affects their platelet count. I'm not sure what the medication may be called in Africa. You would be more of an expert on that, but it would be anything, as a nurse practitioner, it's anything that has to do with affects their platelets, because they should not be on that 2 weeks prior to surgery or 2 weeks after surgery, again, because it increases their risk of bleeding from the surgical site. Mm-hmm. We only recommend patients take Tylenol products or acetaminophen, so that it does not increase their risk for bleeding and will help them with any discomfort. We also sometimes, depending on the type of procedure, use narcotics, very short term, under 5 days, and we use a combination codeine and a combination of Tylenol to help the patient post-op with the discomfort from the pain. We sometimes put patients on antibiotics after surgery, and that's done prophylactically to prevent any infection. And we personally use a cephalosporin, which is like a cousin to penicillin, and we only use that for a few days. If someone's allergic to penicillin, type medications, we put them on medications called clindamycin. And again, not every surgical procedure gets an antibiotic after surgery. It depends on the type of surgical procedure. So if you would like in the future, I'd be happy to give you that Cabrini scale to give to your community, and to give you some information on pre and post-op surgical procedures.
Thank you so very much, Dr. Cherovsky. Thank you for having us on your agenda today. Do we have any questions from the audience before we let Dr. Cherovsky go, because she's not feeling very well today?
Yes.
Okay, so I'm listening.
Joyce asked, what can you do about internal scar tissues after liposuction?
Internal scar tissues after liposuction. Dr. Cherovsky, a viewer is asking. Yeah.
So I think without seeing the patient, I think if a patient's had liposuction and now they have a firmness to the area, or because usually liposuction scars are very tiny. Mm-hmm. They almost look like very small incisions. They're like half a centimeter or less. Mm-hmm. If that area is hardened up, usually it's because the fat has hardened up. You've had some fat necrosis that we spoke about before. Oh, yeah. If the scar, which should be very tiny with liposuction, if it is hard, it depends on the procedure. So maybe the patient had the procedure within a year. That scar still soften up over time. So sometimes you just need the time. Okay. If it's been over a year, then sometimes you can massage it. You can massage the scar either manually with your hand, or use like a ball and massage over the area with a warm cloth. Mm-hmm. That may help break up the scar tissue. But without seeing it, unfortunately, I can't help more with an opinion.
Okay, now breaking up the fat is not like breaking up a blood clot or something, right?
No. When you have, it's almost like if you hurt yourself, okay, and you hurt yourself and you develop like some mild bleeding. Okay. Underneath the skin, or sometimes you hurt yourself and you hurt your muscle or your fat tissue. If you fell on your buttock, you may hurt your fat on your butt, because we tend to have a lot of fat on our butt. Yeah. That may harden up over time because it's been injured. The body looks at surgery like it does an injury. It can't differentiate. So that hardness to that scar may be because the fat hardened up. So you can try massaging it. It's not going to hurt. It's usually not going to hurt. Or you can go back to the provider and say, listen, is there anything you can do to help me for this?
All right. Okay. Thank you so much. Do we have any other questions? No, I do have a lot of questions, Dr. Cherovsky, but I will be discussing that personally with you because I would like the Botox, the fillers, everything you can advise me to get.
And I'm going to talk you right out of it because you are just too gorgeous.
Thank you so much, Doctor. It was a pleasure to be with you, and thanks for all.
It was my pleasure, Regina. Thank you so much.
Thank you, and
Have a good day.
and feel better.
Thank you very much. Have a good day, everyone.
Thank you. And so we come to the end of another very exciting episode of your Saturday online program. Now, if you were too embarrassed to ask your question, DM us, direct message us, and then we'll forward your question to the doctor, who I'm sure will be happy to answer them for you. And this conversation continues on Facebook. Ask your questions and make your comments underneath the video, and we will keep it going. I hope that you all have been educated on the dangers and what to look out for when it comes to body enhancement surgeries. Oh, I forgot to ask when it becomes, when body enhancement becomes body dysmorphia, but that will be another day, and I'll put it in the commentary so the doctor could help us out. For now, I will have to say it's been a pleasure to have you all from all over the world. I would like to say thank you for joining us. Good night, God bless, and see you next Saturday. Bye-bye.